a weighted blanket feels convincing before any data arrive. Pressure can feel calming, the fabric feels substantial, and the ritual signals bedtime. But does sleep actually improve? In a 102-person pilot trial, weighted blankets improved a sleep quality questionnaire more than normal blankets after 1 month, 4.1 points versus 2. Yet insomnia severity scores did not significantly differ, and actigraphy did not show a significant awakening difference. A second trial in 120 psychiatric outpatients reported a much larger insomnia effect. The promise is real enough to study and mixed enough to avoid certainty. The newer pilot recruited adults diagnosed with clinical insomnia from 3 hospitals. 52 received a weighted blanket and 50 a normal blanket for 1 month. Most participants were women, and many used sleep medication. Researchers measured the Pittsburgh Sleep Quality Index, the Insomnia Severity Index, daytime symptoms, and wrist actigraphy. 95 people completed follow-up. The design was randomized and used intention-to-treat analysis, but participants could feel which blanket they had, making expectation impossible to eliminate. The trial was also registered after it had begun. On the Pittsburgh scale, the weighted group improved by 4.1 points compared with 2 in the normal blanket group. Daytime sleepiness, stress, anxiety, and fatigue also improved more. But the Insomnia Severity Index did not show a significant group effect. Actigraphy recorded 1.4 fewer awakenings in the weighted group and 1 more in control, yet the between-group comparison was not statistically significant. The most defensible interpretation is better perceived sleep quality and daytime symptoms, with incomplete confirmation from objective movement-based sleep measurement. The earlier Swedish trial enrolled 120 adults with insomnia plus major depression, bipolar disorder, generalized anxiety, or ADHD. Participants received either a heavy metal chain blanket or a much lighter plastic chain blanket for 4 weeks. The weighted group had a large advantage on the Insomnia Severity Index, with Cohen's D of 1.9, and reported better sleep maintenance and daytime symptoms. That is impressive, but it applies to a psychiatric outpatient sample and a specific chain blanket system. The result should not be copied directly onto every healthy person who occasionally sleeps badly. Safety needs more than the phrase "no serious adverse events." A person must be able to remove the blanket independently and turn or leave the bed. Breathing disorders, circulation problems, frailty, limited mobility, pregnancy, heat intolerance, or young children require extra caution and sometimes clinical guidance. Heavier is not automatically better. Commercial advice often uses a percentage of body weight, but these trials tested particular products and flexible protocols rather than one universal formula. Discomfort, overheating, numbness, breathlessness, or panic means the experiment has failed. If a weighted blanket is safe for you, test it like a sleep tool rather than a cure. Keep bedtime, room temperature, caffeine, and medication stable. Use the same blanket for 1 or 2 weeks, then compare with your usual blanket. Track time to fall asleep, remembered awakenings, morning restfulness, and daytime sleepiness. A wearable can add context but does not diagnose sleep. If severe insomnia persists, cognitive behavioral therapy for insomnia has a broader evidence base, and snoring, gasping, or extreme daytime sleepiness deserves medical assessment rather than a heavier blanket. Weighted blankets are not pure placebo and not proven sleep machines. 2 randomized trials found meaningful subjective benefits in people with insomnia, including 1 large effect in psychiatric outpatients. The newer pilot also shows why the story needs restraint. 1 sleep questionnaire improved, another did not significantly change, and objective awakenings were inconclusive. If the pressure feels comfortable, the blanket is safe, and sleep improves, it may be a useful non-drug tool. If not, the evidence does not require you to wrestle with a heavy duvet all night. If you test one, treat comfort, temperature, breathing, movement, and the ability to remove it easily as part of the outcome. A promising average does not override an uncomfortable night, and a blanket is not a substitute for evaluating persistent insomnia or possible sleep-disordered breathing in clinical care.